Hi, I'm Suneetha Rao, Chief Nutritionist at NU Hospitals. Kidney health has gained a lot of importance because of the increasing incidence of kidney disease around the world. Today, on this World Kidney Day, let's talk about the diet and lifestyle changes that one can adopt to decrease or prevent the risk of kidney disease. Diabetes, hypertension, and obesity. These are the leading causes of kidney disease around the world. And these three diseases are called lifestyle disorders for a reason. They can be very well managed or controlled with diet and lifestyle. Let us see what we can do from the diet point of view to reduce the risk of developing these leading causes of kidney disease. Let's talk about carbohydrates. The refined carbohydrates or white flour, white rice, and refined grains are one of the most commonly implicated culprits in developing diabetes or increasing body weight when consumed in excess. When I say white flour, it means the refined grains that actually lack most nutrition but give a lot of calories. Refined sugars or sugars per se also come under this category. When we say sugars, we also mean other sweetening agents which come in different labels these days, like the sucrose, the dextrose, and syrups like the maple syrup, agave, or jaggery, palm sugar. All these are sugars. They contribute to increasing blood sugars to the same extent as what we call table sugar, and they also cause weight gain. So these have to be consumed in very limited amounts. And if you're already a diabetic, these have to be restricted. Now, talking about salts, uh, it's a known fact that we Indians eat a lot of salt. WHO recommends about 5 grams of salt per day for a healthy adult. It's about a little less than a teaspoon, but many surveys have shown that Indians eat around 12 grams of salt per day, which is more than double the amount recommended by WHO. So where do these salts come from in our diet? The simple homemade foods like fried food, papad, pickles contribute a lot to excess salt. It could be a restaurant ordered gravy or soup, and it can be dried fish or canned foods. These are all the foods that actually punch in a lot of salt in your diet. It is best to limit these foods and have in very small quantities. Let's talk about fats. Now, the saturated fats and the trans fats are not only implicated in cardiovascular diseases, but they are bad for the kidney health as well. They clog arteries, they increase weight, and they can increase your risk of developing kidney diseases. Any fat, even good fat, has to be consumed in moderate or small amounts to maintain body weight. Now, when we talk about these foods, the refined cereals, the refined carbohydrates, sugars, salt, and fat, all these are present in processed foods. Processed foods or the packaged foods are loaded with these four unhealthy food ingredients, and added to that, they also contain food chemicals, food additives in the form of preservatives or coloring agents or food enhancers. These are nothing but salt compounds, and eating too much of these processed foods which contain food additives not only add to your excess calories and fats and salts, they also can cause kidney injury by intake of too much salt in the form of additives. Now, for all those gym enthusiasts who want to take nutritional supplements or protein supplements, supplements have to be taken to the extent that they are your diet is deficient in. So it is best to consult a qualified nutritionist to check out as to how much your diet is deficient in protein or any other supplement before starting to take any supplement. Excessive nutritional supplements and dehydration can cause kidney injury. When we celebrate this World Kidney Day, it's around the same time that we celebrate International Women's Day also. So this is a big shout out for all the women out there to take care of their diet and lifestyle and follow a medical checkup plan annually and not neglect their health. When people are consuming a good amount of whole grains, which is not processed, and increased amount of vegetables, fruit servings every day, prevent dehydration. It helps to control diabetes, control blood pressure, and stay in the ideal weight range. And this helps in reducing your risk for developing kidney disease. Thank you.